Hi guys, to start off, carpal tunnel is a condition where the median nerve becomes compressed at the wrist. Pictures below show the sensory and motor distribution of the median nerve. One of the things that can help with this condition is wearing a splint because it helps avoid awkward postures of the wrist and forearm. It puts less stress on the tissue and joints at the wrist area, and it can also protect wounds as it heals.
So to begin, I'm going to introduce the goals we've created for Mr. Petrov. The long-term goal is client will independently carry 2 10-pound weighted buckets for 5 minutes without taking a break and no pain by discharge. The short-term goal is client will independently pick up 10 poker chips with a 3-jaw chuck in 7 minutes with no pain reported by the 4th treatment session. To address obstacles, Mr. Petrov has high blood pressure, arthritis, atrophy in the thenar eminence, possibility of overworking himself, mental health limitations, and his first language is Ukrainian, so his English can be hard to understand at times. The strengths Mr. Petrov is coming into the treatment session with are as follows. He seems to have a good relationship with his wife. She's very supportive. He has motivating factors for treatment. He has family that lives next door, and he's also Catholic. So spirituality could be an important part of his treatment. Some precautions that therapists must take when working with Mr. Petrov is he's post-op 2.5 weeks, which means he's at a level 1 in the levels of care continuum. This means he would need wound care, engage in only light self-care ADLs. His blood pressure would need to be monitored during activities, and his pain levels should also be monitored, especially due to the arthritis. It's very important that Mr. Petrov is not overworked because it could slow down the rehabilitation process. For strength and coordination, Mr. Petrov's going to need to have high levels of both to continue working on the farm. He will progress in therapy up to a level 3 in the levels of care, which is the work hardening level. This is because of the intensive demands of his job. Next, it's important to address Mr. Petrov's meaningful roles. There are other meaningful roles that he could transition to, which will allow his son to take over more physical chores on the farm. Mr. Petrov could take more of a role as a grandparent. He could offer to watch his grandchildren while his son helps with heavy farm-related work. Mr. Petrov's grandchildren could do light work with him around the house, which would not only help him out, but also allow them to spend time together. It's important to note that the transition of aging is a normal process. Family education, intervention application, and role definition are all important parts of occupational therapy. So questions like this would be appropriate. Mr. Petrov's interests include doing yard work and playing poker with friends. Due to his condition, he has a limited ability regarding engagement in these activities. Mr. Petrov would benefit from the following adaptive equipment: no contact vibration gloves, padded handles for his farm tools, using automatic tools versus manual tools. As far as adaptations go, Mr. Petrov could use energy conservation techniques. So activities that are more physically demanding but within therapy precautions should be done early in the morning, which would help with energy conservation. Light activities around the house should be done in the afternoon, and breaks should be incorporated into his schedule. Breaks could serve as a great time for him to visit with his grandchildren. Activity modification would be important while he's performing tasks to decrease repetition and increase efficiency during work. To control edema, Mr. Petrov should compress the area, apply ice, elevate the area above his heart, and keep the joint mobile. To address fine motor deficits, he could work on picking up poker chips, picking up a toothbrush and brushing his teeth, cooking food and meal preparation, and buttoning a shirt. So he came in wearing a flannel, and it would probably be very meaningful for him to do this. Mr. Petrov seems to be having a difficult time coping with his recovery. So to address his psychological state, therapists could work on having him do activities he believes is helping his wife, and this would help him fulfill a meaningful role. Also, getting Mr. Petrov on a schedule will be very beneficial for his mental health and could ensure he's taking breaks to practice self-care. This could be in the form of going to see his grandchildren or playing poker with his friends. It's important to note that individuals with carpal tunnel syndrome should avoid repetitive wrist flexion and excessive pinch. It's specifically the 2-point and 3-point pinch. Finally, Mr. Petrov will be sent home with a home program that includes simple nerve and tendon glides. This can be demonstrated by giving the client a pre-recorded video so he could do the straight, the claw, the roof, and the fist hand positions. It's important to decrease swelling in the hand, and edema management should be done at home for added exposure. So he's going to continuously apply stress so it doesn't lengthen the healing process. And make sure he doesn't overexert himself. So he's only going to do as recommended for his home program.
Moving on to Ursula's case, her long-term goal is that she will complete a 10-step meal prep activity independently with no reported pain by discharge. Her short-term goal is that she will independently complete a dressing sequence with a score of no more than 3 out of 10 on an analog pain scale in 4 treatment sessions. Some obstacles we found for Ursula include her rush to return to work, she smokes cigarettes, she has slight edema, sensory deficits, fine motor deficits, weakness in both hands with her dominant hand being weakest, and possibility of overworking. Some strengths, however, that we found included the support of her church and family. She's relatively young, she's very active in the church, her husband shares the daily chores around the house, she has hobbies, she has no deficits in cognition, perception, and hearing or vision, and she has an extremely positive attitude. Some precautions to keep in mind for her would include wound care, edema management, and making sure that she doesn't overwork her wrist. Some adaptive equipment we thought of was that she could use ergonomic hairdresser scissors, long-handled sponge. Due to her prognosis, though, we would probably limit the adaptive equipment she would use and more adaptations we would focus on. So some of these adaptations would include activity modification. She reported that she had difficulty putting on her bra, so we would incorporate sports bras, some slip-on shoes or sandals, a pump shampoo and conditioner bottle at work so she doesn't have to squeeze a bottle, and we would create a schedule with breaks in between each client at work. Some purposeful activities to address fine motor deficits in Ursula would be cutting activities with scissors or a knife, and picking up and manipulating bobby pins, since she most likely deals with those at work, and picking up a toothbrush and brushing her teeth require fine motor skills too. To address her psychological state with coping, we said that we would incorporate DBT techniques to work on acceptance that she's doing the best she can with her circumstances at work, and we would talk about some mindfulness techniques so that she can stay positive through her recovery process. And when discharging, planning a home care program for Ursula, we would include simple nerve and tendon glides for both of her hands. Even though she only had surgery on one, she still has mild carpal tunnel on the other, and we want to prevent it from getting to surgery. So this would include the straight claw, roof, and fist hand positions. We would stress the importance of rest when not at work and explain that this is important to follow, as it'll increase her participation in daily activities and prevent her from not being able to go back to work. Moving on to the treatment plan, our group name is the Red Hot Chili Preppers. The model that we used to create this plan was MOHO, and the purpose of this group is to focus on fine motor skills with ADLs and IADLs. The referral criteria for this group includes diagnosis of carpal tunnel syndrome by a physician and referral to OT services. The group will consist of 5 members and will be closed as it needs a referral from their OT evaluation. And group goals would include being able to cut ingredients pain-free, being able to manipulate ingredients and supplies, and being able to use assistive equipment. Discharge from the group would be when an individual is able to prepare and cook a meal efficiently and pain-free. The reason that we created this group is that cooking gives you a final product, and this can be a motivating factor for some clients, and cooking is important because it's oftentimes a part of their roles in their lives. So the treatment session would start out with instructors introducing cooking activity for the day, followed by experiential learning. The session would facilitate exploration of different cooking methods. The instructor facilitates discussion of the group cooking activity and has members reflect on their experience and opinions. So the leadership style would be considered directive since the instructor is providing all of the activities and it's very structured. The group would meet at the OT Rehab Kitchen once a week from 12:30 to 1:30 p.m. And for our session that we planned out today, the supplies would include a rolling pin, mixing spoon or whisk, food coloring, pre-made cookie dough, where you only have to add eggs or butter, sprinkles, a baking sheet, knife, oven and other appliances, mixing bowls, 2 per person for this activity, and oven mitts. So the equipment will already be available in the kitchen. So for this session, we will only need to purchase food coloring, sprinkles, and pre-made cookie dough. So the cost will be about $15 to $20.
Okay, so to address our treatment session, the introduction is going to be our warm-up. So the therapist will ask clients to state their name and their favorite food to make. Then the therapist will introduce the cooking activity that will be completed during the group session. During this time, the therapist will introduce any adaptive devices that can be used during meal preparation that day. For the activity, the therapist will distribute materials and ingredients to each group member. First, the group members will place the cookie dough mix in a bowl and crack an egg. The group members are going to mix the dough until all ingredients are equally combined. Group members will separate the cookie batter so half is in each mixing bowl. In the mixing bowl, so in one of them, they're going to drop some food coloring and mix all those ingredients together. Next, the group members will roll out both of the bowls' dough separately. The group members will lay the dough on top of one another and then roll them together into a log. After this, the group members will put the sprinkles on the baking sheet. They will cover the log in sprinkles by rolling it across the sheet. Next, group members will spray the cookie dough with the cooking spray and cut the log into an inch-thin cookies. Cookies will bake for 15 to 17 minutes and group discussion will take place while they're baking. When the cookies are done baking, then they're going to be taken out of the oven while safety precautions are being practiced. Cookies will be placed on a plate and group members will clean up the kitchen while they're cooling. Alright, so for the sharing portion, which is the group discussion, there's going to be a reflection on the difficulty of the activity and their overall opinions on the experience. So therapists will prompt the group members on what would make the activity easier so that they can utilize these suggestions when they go home. For processing, therapists will ask group members how they felt about the activity. So what was hard about it, what was easy about it, and then therapists can ask if this is a recipe that they would use in the future and why or why not. For generalizing, therapists will ask the group members what they learned about themselves while they were doing the activity. So therapists will ask what parts of the exercise affected them the most. For application, therapists will ask if they have any ideas on how to make cooking activities easier at home and make them more enjoyable. So therapists will ask group members how they felt when they were cooking, and mainly it's just kind of seeing what emotions surfaced. So for summary, therapists will summarize the main discussion points that are applicable to the group discussion. So examples would include cooking as a part of one's identity or household role. Cooking could be a means of independence and creativity, or using adaptations and adaptive equipment could increase cooking efficiency.